Good day, everyone, and thank you for joining us for today's webcast, COVID-19 Vaccines and Children. My name is André Picard. I'm the health columnist at the Globe and Mail, and I'll be the moderator for today's discussion. Before we begin, I want to acknowledge that the land on which the Globe and Mail headquarters are situated is on the traditional territories of the Wendat, the Anishinaabe, the Haudenosaunee, the Métis Nation, and the Mississaugas of the Credit First Nation. And the place we call Toronto is still home to many Indigenous people today. After about 2.5 years of online events, we're getting pretty good at these, and we don't anticipate any technical issues. But if you do experience problems, please click on the help desk icon, which is at the bottom of your screen, and we'll try and get things sorted out as quickly as possible. I also want to begin by thanking the Royal Society of Canada, which is sponsoring today's event, which I think is a very timely discussion given what's going on in Canada. As you know, we're in the midst of a triple-demic, overlapping outbreaks of influenza, respiratory syncytial virus, RSV, and COVID-19. These respiratory viruses and the illnesses they're causing are wreaking havoc on pediatric hospitals and, of course, on many parents' lives. I'm guessing that many people in the audience have firsthand experience dealing with a feverish child, one who's wheezing and gasping for breath, unable to find pain medication at the pharmacy, find yourself waiting for hours in the emergency room that's packed with other sick kids. I imagine, too, a lot of parents couldn't make it here today because they're busy taking care of their sick kids. So please share this video a little later. It's really hard to convey, though, just how frightening these situations can be. So we want to give you today some practical advice dealing with these issues, in particular, prevention. The best defense against COVID, the flu, RSV is prevention. It's trying to ensure kids don't get sick in the first place. So we have a host of prevention tools: vaccination, masks, good ventilation, staying at home when you're sick. Today, we're going to touch on all those issues briefly, but we're really going to focus on the importance of vaccines because it's such an underused prevention method. We've gathered a great panel of experts. I have a lot of questions for them, but I also want the audience to weigh in. So just type any questions you have in the Q&A box. Again, it's at the bottom of your screen. It might be at the top if you're watching on a phone, and I'll do my best to incorporate your questions into our conversation. We're not going to have a separate question and answer period because when we do that, everyone waits until there's 1 minute left and we don't have time. So try and anything that passes through your mind, type it in there and we'll try and get it in. So let me start without further ado by introducing our panelists. They all have very impressive biographies. They're all 10 pages long. So all I'm going to do is give you their titles, and we can, because we really want to spend our time talking with them and not about them. So let me start with Dr. Upton D. Allen. He's a professor of pediatrics at the University of Toronto and chief of infectious diseases at the Hospital for Sick Children. Welcome. Dr. Christine Chambers is a professor of psychology, neuroscience, and pediatrics at Dalhousie University, and one of the founders of It Doesn't Have to Hurt, a campaign that you'll hear about a little bit later in our discussion. Dr. Joanne Langley is also in Halifax. She's a pediatric infectious disease physician at IWK Health Centre and the Kai-Hai GlaxoSmithKline Chair in Pediatric Vaccinology at Dalhousie. And last but not least, we have Dr. Manish Satarangani. He's the director of the Vaccine Evaluation Center at BC Children's Hospital in Vancouver and an associate professor of pediatrics at UBC. Now, I know you're all very busy these days, so we really appreciate you taking time out to participate in this educational event. As I said, a lot of parents are really worried and are looking for answers. So if I could wade right in, I wanted to start with Dr. Upton Allen. If I could start with you. Every day there seems to be an alarming number of stories in the media. I know we do a lot of them at the Globe and Mail about the impact of these respiratory viruses on children and on parents. So I just want to ask you to start off with, how are hospitals like Sick Kids and your staff, how are you coping?
Well, thank you very much, Andre. It's a very important question. Virtually all the children's hospitals are seeing increasing numbers of children with the respiratory viruses, RSV, influenza, and some with SARS-CoV-2 because of COVID. It is challenging. We are coping. We have all the hospitals, a dedicated group of individuals who are really working really hard over time to ensure that we deliver the best care to children. But it is challenging, to say the least. But we continue to work hard to ensure that kids do still get the best care. But as we deliver this care, we are cognizant of the fact that we really do need the support of our colleagues in the communities around us, in the primary healthcare practices, who can help to prevent emergency departments at the major hospitals from being overrun with cases. We really do need their continued help, and they've been doing a great job so far.
Yeah, it's a good message that this is not just about hospitals, but family docs, pediatricians have a lot to do. And I'm going to ask you a little later on, when should a kid go to hospital? But I'm going to save that one for later. So Dr. Joanne Langley, if I could turn to you, we're going to talk about the importance of vaccination today, but I wonder if you could give us a sense to start off with about how many kids are vaccinated. Is it a lot? Is it none? Where does it fall for things like COVID and influenza? How many kids have their shots? I know that we don't have an RSV vaccine yet, but I'm going to ask you about that later too.
Okay, thanks so much. So as you alluded to, immunization is one of the world's greatest interventions to reduce childhood death, disability, severe illness. I'll just mention the routine immunizations, which are always occurring year-round and have been interrupted by the pandemic. So we now have large proportions of children all the way through to the adolescent vaccine programs that have not been able to get their vaccines because of the way the pandemic led to shutdowns for in-person visits. It led to people staying home. And so that is one of the problems that public health has to deal with now. With regard to influenza, the National Advisory Committee on Immunization recommends that every Canadian 6 months of age and older consider getting an influenza vaccine. And that's every year in the fall. And you can still get those vaccines now. Almost every province offers it to children routinely. And I would highly recommend that. In the very first year you get your vaccine, you'll need 2 shots if you're under 9, but after that, it's 1 shot a year. With regard to COVID-19, we call that information vaccine uptake or vaccine coverage. The statistics for the youngest children aren't that accurate, I would say, at this moment in the pandemic, but overall, the uptake is less than we would like. There was sufficient vaccine procured in Canada for children to get vaccines. So no child should be unable to get a vaccine because there isn't vaccine there for them, because it is there. So there's still a lot of work to do in helping families understand that this is a safe and effective vaccine. It's in their child's best interest. And there are great ways, if you are anxious yourself about vaccines or you think your child might be, to make that a positive experience.
And I know the data aren't great, but do we have I have the sense that the vast majority of kids are not getting these 2 vaccines, flu and COVID.
Yeah, so it's highest probably in adolescents, so 12 years and above, and a little higher in 5 to 11 years old, and less in 6 to 4 years old. And I'm looking at Manish, he might have more recent data than me, but I think it's not more than 60% for that whole age group.
Okay. Dr. Christine Chambers, we heard, these numbers aren't great, especially given what's going on. Can you help us understand why are parents hesitant? Why aren't they rushing out and getting their kids vaccines rather than going to the emergency room with them?
Yeah, I mean, I think there's a lot of complex reasons why parents are, not getting their children vaccinated right now. And I think part of it is just parents are nervous, parents are tired. Parents maybe are not accessing the right information or getting the right guidance. I also know that from our research that some of the more like practical and logistics factors actually interfere with parents' abilities to get their children vaccinated. We know that, for example, fear of needles is a significant issue for children and for families. And so sometimes that gets in the way of children and families getting the vaccinations that they should.
And so not everyone who's not getting vaccinated, these are not all anti-vaccine parents. There's all kinds of stuff coming into play.
Yeah, I mean, there's a group of parents we know where they're really kind of on the fence, and some of these kind of practical issues, barriers, challenges actually getting to vaccination appointments, fears of needles. These things can really be a problem. And so I think being open with parents, sharing solutions. There are lots of strategies, as Joanne mentioned, can make needles hurt less and make it a more positive experience for families. And so I think we really need to make sure that we're all doing everything we can to make vaccination as positive an experience as possible.
Great. So Dr. Manish Senarangani, thanks for your patience. We have you as number 4 here. We've heard about hesitations of parents. We've heard the numbers aren't great. Can you talk to us a bit about the science? How effective are these vaccines? Are they safe? Should we be worried about side effects? Some of the stuff that parents have some worries about.
Yeah, no, that's a great question. Thanks, Andre. And I think these are common questions. So we have an immunization clinic here at BC Children's Hospital where we see families with these concerns. And I would say that the commonest questions really come to those that you've mentioned around how do we know these vaccines are safe, and how do we know they're going to work? And particularly in the context where we are in the pandemic now, where the majority of children will likely have had a COVID infection at some point as well. And so there's a lot of questions I get as to, aren't they already going to be protected from their infection? I think on the safety side of things, essentially we've seen and very publicly seen the process for how vaccines get to, from being in a lab into getting into people's arms in the population. And they go through very rigorous trials in the lab and in testing before they even get into a human, and then through very carefully controlled studies in small number of individuals before we see the larger trials that were for COVID initially done in adults, in tens of thousands of adults, and then into thousands of children. And now we've got to a point where millions of children have been vaccinated with these COVID vaccines. And I would say on the safety side, that is something that is analyzed throughout. So from the very first time that vaccine goes into an individual, their safety is monitored extremely closely in the initial phases through blood tests that are done regularly, just to make sure there's also not things that these vaccines are causing that we might not see, just by examining someone or asking them some questions. And then into those tens of thousands of trials, those people are also followed after vaccination to look for events that may occur, the things that we expect, the sore arms and the fevers and things in the first few days, but also, the things that may be more uncommon afterwards. But then even once they're approved and used in the communities and used in the populations, that safety surveillance is ongoing nationally. And there's multiple different methods in place to analyze safety. So, any adverse events that occur or side effects that occur, whether or not people think they're related to the vaccine, if you've had something serious that's happened after vaccination, they get reported through the public health system, and it all gets reported up to the Public Health Agency of Canada so they can pull the data together from across the country and identify signals. And then there's also, active surveillance studies in addition to that going on through groups like the Canadian Immunization Research Network trying to look very carefully at those side effects. And I think for me, the reassurance around those systems being robust is that we've identified what it is in really very rare side effects like the cardiac events, the heart events like myocarditis and pericarditis. At a population level, they're very rare, but the safety methods we have in place have been able to identify those. Some of the blood clot issues that were identified early on with the viral vector vaccine, the AstraZeneca vaccine, also were identified through this safety surveillance that we have in place. So I think in the safety side, this is ongoing. And if anything new comes up as the vaccines continue to be used by more and more people, then we would see them. But at this point, we're talking about extremely rare events given how many children have received these vaccines. On the effectiveness side, again, this is something that is looked at in different ways, through measuring the immune response after a vaccination, to following children through the clinical trials to see who is getting or isn't getting infected. But then also, again, once the vaccines are rolled out, we have really excellent public health systems that are very closely integrating data from who has and hasn't been vaccinated and who has and hasn't been infected to try and pull together exactly how effective these vaccines are. And I think we've seen throughout different age groups that there is effectiveness and there is protection. And I think importantly, it's above and beyond the protection that you get just from a natural infection. And even in people with natural infection, there's clearly benefit of getting more robust protection through vaccination.
Right. And Joanne, I wonder if you could elaborate a bit on this effectiveness question, because I hear this from people all the time. Well, they don't work. They don't prevent us from getting COVID and the flu. What does effectiveness mean? And they're still useful to get these shots.
hmm So there's a lot of terminology that goes around, and effectiveness is one of them. Another term is efficacy, and that's the result that we see from a clinical trial in an ideal circumstance. So effectiveness is kind of real world. How do they work in the real world? And the effectiveness is definitely very reassuring. It can be, about 75% overall after you've had a dose of COVID-19 vaccine. We continue to follow these data because there will be variants emerge over time. What's perhaps most reassuring for a parent to know is that they protect against those severe outcomes, severe enough that a child has to come to a hospital to be cared for. So if you're sick enough to come into a hospital, then you have need of something to help you breathe, something to help your heart work, to provide care that you can't provide as a parent at home. And that's why we use that as a marker, as an outcome measure to say, are the vaccines protecting against these outcomes? And they clearly are.
Great. And Upton, that gives us this opening to come back to when is your child sick enough to go to hospital? Parents don't always know that.
Yeah, no, it's an important question, Andre, that parents really do want to know. When we think of the course of viral infections, for most kids, the overwhelming majority of kids, we see that they progressively get better as each day goes along. But occasionally we'll see kids who are getting better and then they start to get worse. And so parents should be aware of that type of a scenario of the kid who is getting better and then deteriorates, that they should be seeking medical attention. But there are other signals that they should be aware of. The child who is not easy to be aroused, is not eating or drinking, is having difficulty breathing, has evidence of blueness around the lips, or if you're light complexion, you'll see, blue tinge skin color. These are things that families should be aware of as they try to determine whether or not their kids do need to be seen by a physician. Very important to recognize the point that I made earlier of the child who's getting better and then starts to get worse, because that might herald the onset of complications of the initial infection that would otherwise have been quite mild.
And we have parents who say they read in the paper, well, it's an 8-hour wait in the emergency room. They hesitate to go. What can you say to parents? Should they go anyhow if they have any concerns?
They should go if they do have concerns. In the provinces, there are numbers that you can call. You can also get in touch with your family physicians or healthcare providers, but you really should get plugged in. It's really important that that is done as soon as possible. In relation to the things that I mentioned earlier, that, for example, kids who are having difficulty breathing, you don't want to be waiting at home. You should really go and get seen.
Great. And I want to thank the audience. Already some great questions coming in. I'm going to get to them soon, but remember in the Q&A box, you can get in there and help me along. So Christine, I want to come back to something I alluded to earlier, and you mentioned this, a lot of kids, a lot of parents are afraid of needles. There's this needle phobia out there. And you are part of this great social media campaign, It Doesn't Have to Hurt. Can you tell us a bit about, how can parents prepare their kids for shots? How can we avoid this trauma that I know I had as a kid, being frightened of, having a bad experience and then make me frightened for many years? How can we prevent that in the first place?
Yeah, I mean, fortunately, there's a lot of research that's taken place that has shown us how we can significantly reduce pain and make vaccinations and other needle procedures more positive for kids. Some of the things that parents can do, for example, there's a topical anesthetic patch that you can purchase at your local pharmacy and apply that to the skin before the needle. It significantly numbs and reduces pain. But there's also other strategies. So, for example, babies who are breastfed, you can breastfeed during vaccination. It's actually been shown in many trials to significantly reduce pain. If you're not breastfeeding, a sugar water, a sucrose solution also has been shown to be effective. But also strategies like distraction and relaxation, just having a plan. I bring, my iPad with me and make sure I've downloaded something that my kids haven't seen recently or they find novel. It's a really easy thing to do. And research has really strongly supported distraction for reducing vaccination pain and distress. And those studies have shown that it doesn't actually matter what you distract your child with as long as they are distracted. So even if it's counting ceiling tiles in the clinic room, like that is something. Encouraging your child to take deep breaths and making sure that parents manage their own anxiety, because we talk about kids not liking needles and kids being afraid of needles, but a lot of adults don't like to admit that they also don't like needles. So these are some simple strategies that we can use and really helping parents to make it a positive experience and use age-appropriate terminology. Don't lie to your child and tell them that they're not going to get a needle. I know the first thing kids ask when you tell them you're taking them to a doctor's appointment, they'll say, "Am I going to get a needle today?" Be honest, explain the importance, and stay calm.
Yeah, you're going to get a needle, but you're also going to get an ice cream cone after, has been my strategy over the years. So, Manish, I want to go to an audience question because it's one I hear so often in my work. Children don't get sick from COVID, so why should they get the vaccine?
Yeah, that's a great question, and I also hear it very often. And I think the first thing is, I think I'm really grateful as a pediatrician that we haven't seen the sort of extremely severe disease in the most part in children as we have seen in some adults and some other populations. So I think that is true, and it's true that thankfully for most children it's a relatively mild illness. But at the end of the day, we have still seen across the country and internationally a large number of children being admitted with severe complications, either from the initial illness, and also particularly early on in the pandemic, we saw this relatively rare complication called MISC, or multisystem inflammatory syndrome, in children, where children a few weeks after the infection were getting inflammation in all sorts of organs of their body, and it wasn't related to the severity of that initial COVID infection. So they may have had just a relatively mild COVID infection and then get this complication a few weeks later. And I think that the challenge is, while we can to some extent maybe predict who those children are going to be, so we know children who have multiple other medical problems, may be at higher risk of getting a more severe infection. We've also seen a large number of children who are otherwise previously completely healthy be admitted to hospital, need intensive care with severe COVID infection. And I think at the end of the day, for me as a pediatrician, as a sort of a vaccinologist, as it were, I think that every one of those cases that is potentially preventable is really a tragedy to see, a child in the ICU that would have had a potentially preventable thing. So I don't think, we should be sort of putting a cost onto, how many is enough. I think, to be honest, it's not been, I think that having that comparison between the adults and children and saying, oh, the kids haven't had it as bad as the adults, in some ways hasn't been helpful, because it's really underplayed the significance of the disease that we've seen in children. And if we see no cases in adults and we just had what we were seeing in children, I think people would have been raising a lot more noise about it, and there would have been a lot more discussion about it. So I think the bottom line is that, yes, it's mostly a mild infection, but we still do see kids with severe cases that end up in hospital, and we just don't know who those are. And I think we have safe and effective preventive strategies like vaccines available, so we should be using them.
Yeah, I find frustrating. People say, "Oh, well, kids don't die of COVID," and I always answer, "Well, kids shouldn't die of anything, right? They shouldn't, of course, die of COVID." So, Joanne, I want to talk a bit about misinformation, particularly about mRNA vaccines. There's a lot of misinformation. They alter your DNA, stuff like that. Can you give us a sense about how this technology works, if you can do it in simple terms for the public?
Okay. So the mRNA vaccines started to be developed about over a decade ago, based on the idea that you could use part of your own cells to make a really perfect antigen that would cause an immune response, that would be a vaccine-induced immune response. So the mRNA vaccines use a small piece of genetic information, just a tiny part of the overall, it's not a whole virus, it's just a tiny part. And that is used by your cell to produce the part of the COVID-19 virus that our body then makes an immune response to. And then that will last for only a few hours because those cells pass away. Just like we do normally. All of our cells have a life cycle, and some of them only last for a short time. So then it's gone, but what you're left with is this memory of that exposure to the virus, that when you see it again, your body ramps up that immune response and gets the factory going to make a full-fledged immune response to protect you. So I guess the overall message is we're providing a very small amount of a virus component that allows our own body to make an immune response that's very strong. And the vaccine that we were originally given is long gone within days of us having received the vaccine.
Great. That's a very best simple explanation I've ever heard. So thanks for that. That makes it a lot clearer for me. I hope we'll see how the audience responds. I think they'll like that too. Upton, I want to come back to you. I was thinking when you were talking at the outset about this, how much work your colleagues are doing and yourself, that it's got to be really frustrating to be treating all these sick children, knowing that a lot of these cases are preventable. I wonder what message would you send to parents on this, that that you want to say when you're working every day and dealing with these sick kids?
I think it's really important, Andre, that we all work hard to ensure that parents have the right information that can be used to make decisions. Because when Christine alluded to this earlier on, I mean, it's so important that we don't end up with hesitancy or reluctance on the part of families to be vaccinated because they are being provided with wrong information. And so what it means is working with these families as healthcare providers, we can connect with communities, with families, to ensure that families have the correct information on which to guide their decisions. It is a process that requires careful coordination with community leaders so that one can get the message out. There are just so many, there's so many questions that have popped up that are based on misinformation. And so we need to work to correct that so that they're making decisions based on the right information. There are also issues relating to just clarification of things that might be in the media. So, and Dr. Langley alluded to how work on the vaccine started many years ago, and families will often say, well, I don't want to get my child vaccinated because this vaccine was rushed, And the reality is, Andre, the work on the SARS-1 vaccine started shortly after SARS-1 in 2002, 2004. It turns out that the SARS-1 virus is about almost 80% identical to the COVID virus. So there, by 2007, 2009, scientists had information that enabled them to determine how to make a vaccine to target SARS-1, which is 80% identical to the COVID virus. So that, coupled with what Dr. Langley mentioned earlier about the work on the mRNA vaccine, meant that when COVID came along in 2019, 2020, guess what? By luck, by chance, the research was a decade ahead of the arrival of the virus, at least a decade. And another way to look at this, Andre, we don't want to digress too far in this, but another way to look at this is that if COVID had happened in 2002, 2004, I don't think we would have had a vaccine for several years. And so we're kind of really lucky that things played out the way they did.
Yeah, the speed at which we got a vaccine really was an amazing bit of science that I don't think people fully appreciate. So
absolutely,
I'm glad you underscored that. Christine, I want to come back to this hesitation part. You're a psychologist, so I wanted you to help us understand. I see parents who say, "Oh, I've got my COVID vaccines, I've got my flu vaccine, but I'm not giving them to my kids. It's not safe for kids." What are they thinking? How do you square that circle?
Yeah, I mean, it's a really challenging time and space. I mean, there's so much information out there, and we don't do a good job as scientists making the science as accessible as some of those other sources of information. And so I think parents are hearing a lot of conversations. They're talking about it in hallways, on Facebook. And so I really approach it as, like really encouraging parents to remember sort of who's bringing the expertise, who has the experience, who can we trust? And I feel sad that during this pandemic, despite this incredible scientific achievement, that we seem to be in a place where people have lost trust in science and lost trust in a lot of expertise. And so I think we all need to work together to build that back. I think we can normalize that. Of course, it's normal for you to have questions about your child. All parents want to do the right thing for their child. They want to do the best thing. And so I think we really need to get back to thinking about who can we trust, and building back some of that information. And again, part of that's on us as scientists and health professionals. We have a great job of making things more complicated than they need to be at times. And I think that's also part of it is this has been a rapidly evolving situation. And part of science is that we learn more and things get refined or perspectives change. Science is part of building on studies. We don't do one study and that's all the answers. There are other studies. Things change. Viruses change. So I think really normalizing that, we've lived through an incredible period of anxiety. Parents have had an incredible burden during this pandemic, disrupted childcare, disrupted schooling, changes in how we think about children's milestones, isolation. So I think normalizing that it's okay that you felt nervous, that you have been worried about making the right choice for your child, but then who should we trust? Who should we be listening to? And, certainly really encouraging parents to take advantage of these incredible scientific discoveries that have saved many, many lives and will continue to do so.
Yeah, I think that's a really important message, that these questions, these doubts come from a caring place, and we shouldn't be vilifying parents who have doubts. So Manish, another really interesting question from the audience I'm going to throw your way. Someone's asking, how do I prioritize? Should I get my kid the influenza shot, the COVID shot? Should I catch up on routine immunizations? What do I do?
That's a great question. It's like asking me to choose my favorite child between my own children. I mean, I think the right answer is that these are all one is not a replacement for the other, right? So there's clearly there's still COVID circulating. There's been a lot of influenza over the last few weeks. So here in BC, we're still seeing surging rates of influenza, and the emergency department has huge numbers of kids coming in every day with influenza. And as Joanne also mentioned earlier, there's the routine immunizations that every child needs to protect them against all of the other preventable infections. So these have not, vanished from the planet, unfortunately. And so the last thing we want to see right now in the midst of everything else is a measles outbreak, for example. So I think, I think to me, it's a lot of this really comes down to a point that Christine raised earlier, which is around the convenience and the logistics and the practicalities. And I think at the end of the day, in reality, that's going to vary a little bit from region to region. I think it's important that people know where to get the vaccines, where they can get the vaccines from. So for some people, the flu and the COVID vaccines may be available from the same place, whether that's their family physician or whether that's their public health provider. In other places, it may be that it's different people who are giving the different vaccines. And so I think it's unfortunate. And I realize that for some people, that does create a barrier to access care. I think that, all of the vaccine providers that we have, whether it's public health, pharmacists, family physicians, pediatricians, or whatever else, everyone's working really hard to try and make everything as accessible as possible. So I don't think you could necessarily choose one over the other. I think it's really trying to identify from the practical side, some of them can be given at the same time. Some of them maybe, aren't recommended to be given at the same time. So it's trying to figure out for you, what is the most convenient thing, most convenient way to go about it, and again, reflecting on some of the previous discussion, we don't really want to have to, for kids who have that anxiety and fear about needles, and I think, as you said, most kids probably have it to some extent, we don't want to have to expose them to that more often than we need to, right? So I think it's also, considering what is going to be the best thing for your child to try and, yes, we want to do this as quickly as possible to get them protected as quickly as possible, but I think these practical constraints are something that is there, and I think that, it's sort of balancing that all up. But at the end of the day, all of these things plus the routine vaccines are what children need to get them protected and create this wall of protection against these different infections. And unfortunately, we don't have that one sort of magical shot that will protect against everything. So this is the reality of where we're at.
Right. So, Joanne, we heard Manish say the answer to that question is you should get all your vaccines. But parents, and this is another question, how many is too many? Can I get too many at a time? Will it overwhelm my immune system? Lots of worries about that.
Yeah, great question. So there is a recommended schedule if you're behind on your vaccines. And in many cases, you can get multiple vaccines at once. And sometimes you would need to space them. With the COVID-19 vaccines in young children, because they may develop fever and we don't want to confuse what they have the fever in response to, we often might give that one alone. But as the child gets older, you can get flu and COVID at the same time. You can also get some of your regular immunizations. And so I would explore all those options because our immune system is able to handle multiple antigens. In fact, we are handling them all day long. Every time we eat food or breathe air or drink water, we're exposed to viruses and bugs from our environment. And our immune system deals with them and in many cases makes an immune response to them.
So we don't have to worry about the too many question. Our body deals with all kinds of stuff all the time.
Yes.
Great. Upton, I want to come back to you about this. We've mentioned routine vaccinations as well, and we know those numbers are falling. Is that a concern too in pediatrics that you're going to start seeing things like measles again?
Well, that's an important point, and Manish alluded to that. It is possible that if we're not careful, we will see outbreaks of diseases that we thought we had under control or that we rarely see. And as Manish said, the last thing we want in the mix of influenza and in the midst of RSV and COVID is to have measles occurring. And so it is a threat. We need to be mindful of that. And so we need to work with our healthcare providers. Families should work with their healthcare providers to identify the best approach to have these kids vaccinated. And the family doctors, pediatricians, nurse practitioners can work out a schedule for you to decide which ones should be given together and which ones, perhaps ought not to be given together. From the point of view of safety, they can all be given together, as Dr. Langley has alluded to. Andre, one of our senior colleagues in the United States did some work and modeling years ago and had determined, Dr. Paul Offit from the Children's Hospital in Philadelphia, had determined that theoretically our immune systems, the kids' immune systems, could tolerate about 20,000 vaccines at the same time if it were possible to do that. Now, clearly, nobody would ever do that, but it just illustrates the issue of, are the number of vaccines that kids might get together or within a short period of time too many? And the answer is no.
And as we forget, there's been, people who are older may forget there's been a lot of technological advances. There are 6-in-1 vaccines, for example, now. So there aren't necessarily as many shots as people think.
That's right.
Now, Christine, I'm not sure if you can answer this one, but I'm going to throw it at you anyway. Somebody's asking, it's a question I hear again over and over again. Essentially, why aren't we doing vaccination in schools? Especially for working parents, this is a lot of work to get your kids vaccinated. And in the old days, the good old days, we used to do vaccines in school for polio, smallpox, all this stuff. Do you have any understanding of why this doesn't happen anymore?
Yeah, I mean, there are still some school-based vaccination programs, for example, in Nova Scotia in grade 7. And so I think, there certainly is, they still happen for certain types of vaccines. But I think with regard to influenza and COVID, and perhaps Joanne and others might be able to comment more in terms of the context there, I think it just hasn't been a feasible kind of implementation plan. But I do think, the logistical issue for parents. I mean, parents are busy. It is hard to schedule these appointments that often happen during working hours, during school hours. If you've got multiple children, it's hard to take multiple kids for vaccines at the same time. So I do think we need to acknowledge some of these real challenges. And I know things are improving. Here in Nova Scotia, they pivoted to an online influenza vaccine booking tool that's the same as the COVID booking tool, with lots of after-hours appointments at pharmacies. So that was much easier this year for parents. So I think, we've learned a lot through the implementation of the COVID vaccines and those rollouts that's now being extended to other areas.
Yeah, but you're right. We do things like HPV in school, but we don't do COVID. We don't do the flu. I don't know what the justification is, but interesting question. What else? We have lots of stuff coming in. Somebody's asking, this is a fairly technical question. Maybe I'll throw this one to you, Manish. If my child has 2 vaccine doses and then has mild COVID, should they still get a 3rd dose? And if so, when?
Yeah, so that's a great question, and this is something that we've seen and people have been looking at really closely throughout the pandemic. But when the vaccines were initially being rolled out, and then now as we're moving into booster programs and those sorts of things, I think as sort of we discussed earlier, there is some short-term protection from an infection. So, clearly the vaccines are designed to prevent infection, but, we will sometimes still see infections in people who've been vaccinated. And so there is short-term protection, and you will get a boost in your antibody levels to give you that protection, but you're still going to get additional benefit from vaccination. And in fact, there are some studies suggesting that if you've had infection and then you follow it with a vaccination at an interval, that gives you better, even better protection and really additional boost. So there's recommendations currently in place for how long that interval should be. And so depending on the timing of the infection, so in the circumstance that you described, where someone's had their initial couple of doses and they're waiting for their booster and then they get an infection, the current guidance is waiting for 3 to 6 months or so after that infection to get the next booster. And there's going to be a little bit of variability to that potentially, and sort of Christina alluded again earlier to the sort of the changing and the evolution of public health recommendations that we've seen as the pandemic has evolved and as we've learned more. And so, if we see huge increases in COVID in different communities, there may be a slight change to that of saying, actually, maybe we should be doing it a little bit at the sooner end rather than waiting for longer. And even on an individual level, if someone's about to travel and isn't going to have access for a long period of time for a vaccine, then again, they may be individually recommended to have their booster a bit sooner, even after an infection. I think, to me, the most reassuring thing is that the interval that is recommended and that sort of waiting time isn't based on any concerns around safety. And early on in the pandemic, we were vaccinating people, in the days or weeks after an infection, and there was no concerns around the safety. It's really trying to optimize how long that protection will then last for. So I would say any vaccination after an infection will give you a good boost in your protection. There may be some optimal benefit by waiting a little bit longer in some circumstances, but I think at the end of the day, any sort of that additional vaccine after the booster is still really important and it's gonna lead to protection. And just, Andre, if I may, I just wanted to briefly comment on the schools question that Christine touched on, if that's okay. So I think it's a really interesting question, and likewise in BC we do vaccinate in schools in grade 6 and grade 9. So we were actually part of a study being led out of the University of Alberta, and we asked parents exactly that question. Like, if where would you like to go to get your children vaccinated? And a lot of parents did express a desire to get their children vaccinated in schools, but a lot of parents also didn't want to do that. And it's really interesting when you actually ask people then what they think. And for some, there's the convenience of the child already at school. Someone will deal with it. For the younger kids, there were some parents raised concerns around how do we consent for that when the parent is not there and the child is there, and if we forgot to fill in the form or whatever, they don't want to get missed out. But also, interestingly, some parents said, actually, I like being able to go to my public health clinic where I can go with my partner and all of our 4 or 5 kids, whatever, can all go at the same time and get vaccinated rather than dealing with it in 2 or 3 different school locations, and then I still have to make an appointment for myself. So I think what's really important, and I think what we've seen, is that it's not going to be a one-size-fits-all. Different things are going to work for different people. In BC, even with the routine program, we have a mixed model of delivery where it's done through public health, pharmacies, and through GPs and other practitioners. And I think that there are going to need to be a lot of local solutions. And the geography of Canada is such that what may work in an urban area like Vancouver or Toronto or Halifax is not going to be the same in some of the more rural communities. And I think we need to really be looking at what's going to work for each local population and each local community.
Right. Yeah. And when you talk about the family vaccination, I think I saw some pictures of Christine and her family making a family outing of their flu vaccines. There were little, very lovely photos of that. So, Joanne, I had promised earlier I want to ask you about RSV. A lot of parents have discovered something they never heard of before, RSV, in the last few weeks. Why don't we have a vaccine for RSV, and are we going to get one soon?
Mm-hmm. There has been intense work on developing ways to protect children and actually older adults as well against RSV. So it's one of those viruses that can infect you multiple times throughout your entire life, but it tends to cause the most severe illness in young children, in whom it causes a lung infection usually, or trouble breathing. So there are right now 2 main strategies that we think about, in addition to preventing exposure to people who are sick. So not sending your child out to an area where they're going to get exposed to infections. One is to provide antibody that's already formed against the RSV virus. So if a parent would have had a premature baby, for example, or a baby with congenital heart disease, they might remember being offered something called palivizumab, which was an antibody that you inject and it protects you for a month. It would be better to have vaccines because they would provide more long-lasting protection. So with regard to vaccines, there's actually 2 strategies. One is to vaccinate the pregnant mother, and the mother would have already had RSV during her life. So this would boost her immune response, and she would pass all those antibodies over to the unborn baby, and they would have a period of protection after birth, which is the period during which they're most at risk. So that is really advancing, and there is a company that's probably going to, there are trials that are ongoing, and those early results are coming out, and I think we're going to hear in the next year or so about those. And there are also, secondly, studies to look at better antibody preparations that would last for more than a month. So actually last for out to 6 months. So if you gave that to the baby whose mom didn't get a vaccine or wasn't able to get a vaccine, then the baby would have protection for an umbrella just kind of covering them for that first 5 or 6 months. And then there's also vaccines for older adults that are underway, because for adults, and this is for the grandparents, if you're a parent here, RSV can cause an illness quite like influenza once you're in your 60s and above. And you can get pneumonia, you can end up in hospital, and it can kind of move you off your period of being in the community and well and able to do everything for yourself. So that's coming down the pipeline too.
Upton, I wondered if you could tackle this issue that's come up. It's natural immunity. This notion, some people think it's better to get the illness, you get better protection than from a vaccine. Is that true?
There's evidence that if one is vaccinated, and Manish alluded to this, you're vaccinated and you've got natural infection, that there is some benefit to that type of combination. That said, it's clear that vaccination provides a more complete protection than just allowing somebody to get natural infection that just doesn't last long enough. We know that. And so it's much better to get vaccinated to get a much more complete protection. But research is still being done to determine whether or not there are combinations of number of doses and number of episodes of infections that might be equivalent to a certain number of vaccines. And we just don't have that type of data just in yet. So it is still important to get vaccinated. And again, remember, it's so important to emphasize this, and Dr. Langley alluded to this, that the vaccines are aimed at preventing the most severe outcomes from COVID. And so the same thing with influenza. And so that when parents say that, well, my child, if they get vaccinated, they might still get COVID, we need to remember to tell them that chances are you shouldn't get severe COVID, you shouldn't end up in hospital or worse.
Right. Now, Christine, underlying a lot of vaccine hesitancy, driving a lot of the questions today is just misinformation. How can we tackle that epidemic, the infodemic, as the World Health Organization calls it? I know this could be an hour-long conversation, but give us some highlights of how we can start tackling this.
Yeah, I mean, I can share how we've tried to tackle this with our work on children's pain management and our It Doesn't Have to Hurt campaign that you alluded to. I mean, essentially what we tried to do is take, key research findings that are published in journals that most people don't have access to, and work with partners like parenting media to, put these evidence-based messages in digital content for parents on social media. I think we really have to resist, saying, oh, social media, let's not go there. As health professionals and scientists, I mean, we have an obligation to make sure that we're putting our good quality content and evidence where people are already going. If we expect people to come to us, they're not necessarily going to do that. We do need to respect where people are going for information and put it where they are going. So I think part of this is just a different way of thinking about how we communicate about science, how we make science accessible. I think this event is just a great example of, creating opportunities for engagement, for conversation. If we want people to trust science, they have to, trust comes from having relationships and building relationships. So creating opportunities for dialogue, taking down some of the boundaries between the science and the public who need it and who are funding science through their tax dollars. So I think it's just taking a different approach to thinking about how we can position research and how we can position health recommendations in a way that makes them more accessible, more approachable, and gives parents a chance to ask questions and clarify things.
Yeah, and I think it's a good opportunity for me to remind people the Royal Society, which is sponsoring today's talk, has really put this emphasis on good communication and education in a bunch of fields, including vaccination. So that's why we're here. Manish, I want to throw another question to you from the audience. I don't know why you're getting all the audience questions, but it just turns out that way. But somebody's noting that, not all doctors are very good at promoting vaccination. They don't want to have that conversation because it can be uncomfortable. Can you talk about the role of doctors of doing this, just having the talk, because you're very trusted as physicians?
Yeah, no, that's a great point, and I think that that the last point you made is really critical, and I think that studies over and over again done by us in Canada, by others on as part of this panel, and in almost every country you look at have shown that yes, social media is important, yes, the public media is important, but almost every single study shows that the advice from a trusted healthcare provider is where people go to the most, or where they trust the most for their information. But I think the issues you just raised about the infodemic and the challenges of that also applies to how we get information to healthcare providers. And I think we have to acknowledge that everyone is really busy. Everyone is dealing with things through a slightly different lens. And while you've got some people coming at it from vaccines, where that's the majority of what they do, others are other specialists or family physicians are also dealing with other medical problems as well. And so while discussing vaccines is on the list of things that they would like to talk about, or that the family would like to talk about, it's not always the number one priority. And I think particularly with all of the information around there, they sometimes feel a little bit uncertain about what the current advice is, or what the current recommendation is, or what the current science is. So I think it's also, as well as on us to get the accurate information out there to the general public, I think we also, and all of us here and our colleagues, have been working really hard to try and get that information out to those frontline healthcare providers as well, so that they can then use to inform their patients. And so being part of other similar events like this, but where the target audience is family physicians or public health or whoever, to try and give that information. So I think, again, it's sort of along a similar line, really, that we need to ensure, I think it all comes back to really ensuring that we're packaging information in a way that is accessible for the different audiences that are listening to us. It's not going to be a one package for everyone, and the way you need to inform the public is going to be different to how we need to inform our other medical colleagues.
Right, and we're great to have great communicators like you join us. That really helps. So we just have a couple of minutes left. So I want to leave you all with the same question and give me a punchy final answer. I want to ask each of you, what's the one thing you'd like to see Canada do today to improve the uptake of pediatric vaccines? Dr. Langley, maybe I'll put you on the spot first on that one.
That's a tough one. So I think, building on what we've heard about the importance of relationships and conversations and interactions, and not just unidirectional flows of information, I would encourage people that are attending this webinar to become vaccine advocates themselves. If you're here, you are very interested. And we all have, I think, the responsibility to use moderation in our speech. And we are becoming more scientifically literate. I think we can all think about the way we communicate all the health questions that we might be interested in about our families. And the take-home message for anyone involved in healthcare is get the right information and have that conversation with the people with whom you interact, because you could really change a life.
Great. And a good message there that doctors are influential, but people listen to their peers as well. And that's important to talk about this stuff. Dr. Allen, what's the one change you'd like to see that would help the uptake of pediatric vaccines?
What Dr. Langley alluded to is so crucial. We need to ensure that people get the right information on which to make decisions. But it means that we need to think about how, when viewed through an equity lens, various communities get that information. And it won't be a one-size-fits-all strategy at all. And we need to ensure that we recognize the pathways through which the information should flow. And Manish alluded to especially targeted education programs aimed at healthcare providers. But there are healthcare providers in different settings. Similarly, families in different settings. And so I think the one word for me in closing is equity, and to ensure that we approach the information flow through an equity lens.
Great. Dr. Chambers?
Yeah, I think simply making sure that we're promoting positive vaccination experiences and getting kids and families off to the right start with their vaccinations.
Well, that is punchy. Very good. And Dr. Satarangani, last word?
Yeah, so I think we just need to listen. I think at the end of the day, we spend a lot of time talking about the minority of people who don't want to get vaccinated or don't want to get their children vaccinated. The bottom line is that I think most people do want to get vaccinated and want their children to get vaccinated and want their children to be protected, but they have genuine questions. So I think we need to not dismiss them or vilify them, as you mentioned, but we need to listen to them. We need to answer their questions and in a respectful way. And then I think that message can essentially sort of potentiate itself in a way, so that's going to just keep going and keep going. And I think that's what we need to listen and engage and make sure that we're addressing the questions that people want answered in a way that they can understand and they can feel that they've had everything addressed.
Yeah, and a great final message. The vast majority of parents want the best for their kids, and most of them do get their vaccines. And that's a good message. And I think you've helped them understand why today. So I want to thank everyone who's joined us on the panel today, Dr. Upton Allen, Dr. Christine Chambers, Dr. Joanne Langley, and Dr. Manish Satarangani. I also want to thank everyone in the audience for attending, sharing some great questions, some tough questions for us, and of course the Royal Society for sponsoring today's very timely event. Just a reminder to the audience, we'll be sharing a link to the recording of this webcast with everyone who registered in about a week, and we encourage you to share that with your family and friends as well, so these messages get out. So thank you again, everyone, for attending. Please don't forget to get your kids vaccinated, catch up on their routine vaccine, and do it for your sake and do it for theirs. So thank you again on behalf of the Globe and Mail for being there today, and we look forward to welcoming you to our next event in 2023.